Okay, so macrolide. Macrolide, another name is called, the group of this antibiotic is called macrolide. Macrolide, they including the azithromycin, clarithromycin, erythromycin, and clindamycin. So all of them together, I said, we talk about the macrolide. Macrolide. Example of this class of antibiotic is erythromycin, azithromycin, right? Clindamycin, erythromycin, clarithromycin, or azithromycin. Azithromycin frequently used for respiratory tract infection. Respiratory tract infection frequently used, we said, right? So if you give the antibiotic like erythromycin or azithromycin or clindamycin, you have to educate your patient. You have to educate your patient about the side effect, right? So this is the erythromycin, sometimes it's called emycin, shortly called, right? Most commonly that's erythromycin. Another most common drug in this category are azithromycin. Okay. So indication of them are respiratory tract infection or bacterial infection. The mode of action of azithromycin or erythromycin or macrolide, they inhibit the protein synthesis and slowing the bacterial growth. When slowing the bacterial growth means they are bacteriostatic. Side effect of this macrolide, they cause GI upset, they cause these arrhythmias or ototoxicity. So if your patient has to take the azithromycin or erythromycin as a RN, you have to check their hearing loss or any kind of impairment of hearing, or you have to check their pulse rate, respiratory rate. Okay, so definitely vital sign is important to check, or you can check the EKG, any kind of disease may develop or not. Other side effect of this medication, they causes the ototoxicity, GI upset or dysarrhythmia. The key point for this group, take on empty stomach. So this medication is good to take with empty stomach. Empty stomach or empty stomach with full glass of water, right? If you get with full glass of water, it should be good. So what are the other side effects from different book? They causes thrombocytopenia. Thrombocytopenia means decrease the platelet count, abdominal pain, taste change, or super infection, or they cause the Stevens-Johnson syndrome. Stevens-Johnson syndrome, right? Another antibiotic here, this is called antibacterial antibiotic, the group of medication here we are going to talk. This one is called metronidazole, shortly called Fragile. Metronidazole we use for gastrointestinal infection or GI, very bad diarrhea sometime, although it is not the anti-diarrheal medication, but we use, right, fragile, easily talk. The side effect of metronidazole, they sometimes cause dark red-brown urine or taste change, or super infection like candidiasis, peripheral neuropathy, or increase the effect of coumadin. So metronidazole and coumadin, if you go give together, that they causes the increase the effect of coumadin. So not together. Coumadin and metro increase the effect of coumadin. So bleeding tendency, has developed bleeding tendency. Another medication we use called nitrofurantoin or macrobit or nitrofurantoin or macrodentin. Both of them used to treat the urinary tract infection. Urinary tract antiseptic damage the bacterial DNA. The side effect of them, they cause GI upset, hypersensitivity reaction, also blood dyscreasis, peripheral neuropathy, chance of develop brown discolor of urine during the treatment. Another medication we use, antibacterial, is called gentricin, pediatric suspension for acute, recurrent, or chronic urinary tract infection. The common side effects for all of them are chronic pulmonary reaction. They causes chronic pulmonary reaction or GI upset, sometimes causes dizziness, pruritus, or fever. But most dangerous are Stevens-Johnson syndrome. They develop the Stevens-Johnson syndrome. Most important, you should know for NCLEX board exam. So here, then